trend is because of the developed healthcare market now. From the 10 years I've been here, it's grown tremendously in terms of expertise, better doctors, and what that brings is obviously specialist centres like ourselves. From moving on from there, we've now gone into Al Jalila, so moved all our paediatric ophthalmology under Al Jalila, specific paediatric care with our ophthalmology department, which I think is one of the first of its kind. It's a first for us in the region as well. So we will develop on these trends, and I think other specialities will do the same. Yes, I think the model is sustainable in the long term. I think there's pros and cons to being a specialist centre. Obviously we're a standalone unit. We don't have all the laboratories and X-ray departments, so we do have to partner up with such specialist centres or support services. But we find in DHCC that's definitely a bonus because everybody's here under one roof, and there's some great partners that we have that we can manage that service. I think against a general hospital, they can get internal referrals that we don't necessarily. But with our brand being Moorfields, then hopefully we'd become the specialist centre in the region. A general hospital is always going to take more investment, but it's going to be a much bigger site. Multiple specialities, which has a lot of investment behind it. But when you are a specialist centre, your investment is in your doctors and in your support staff, your allied healthcare, your nursing, because you need these specialist skills to be able to develop that. So they cost money. So it probably evens itself out in the long run. I think by going to a specialist centre, we know our business, and that's eyes, and we're very good at that. And we have subspecialist doctors. We don't just have ophthalmologists. We have ophthalmologists that specialise in a whole range of subspecialised areas within the eye, from diabetes, glaucoma, cornea, uveitis, paediatrics. So we're very subspecialised. So from the patient's perspective, if it's anything to do with their eye, then coming here, there's not anything that we won't be able to treat. I think there maybe is a move towards that, but I mean also what you have to be careful of is the market's getting very flooded. There's a lot of other eye care facilities here in the market, so the competition is tough. So what you do to stand out is you concentrate on the delivery of care to the patient, and that's really our main focus. But yes, looking at the market with all the centres, if I talk about ophthalmology, there's a lot in the market, maybe always too many. So yes, we got the challenges we face is obviously a completely different market from the UK. It's a government-backed healthcare system in the UK, like you probably know, to a private market here. So it's a huge learning experience for us, and we learned a lot on our feet, and it's made us better, and it's helped us grow. Even Abu Dhabi now, and now again with our new agreement with Al Jalila, that's a new angle for us, and it's a new venture. So we're constantly learning all the time we're here, and I think you've got to commit to the region and you've got to commit to the market. If you don't commit, then I think you'll fail quite quickly. Well, I think with sort of the public health issues here around diabetes, which relates to a lot of eye problems, then the market will grow. The need is hopefully we will grow with that market, but I think the population is getting bigger year on year, so the need for good quality care is always going to be present. Correct. So I sort of touched on that earlier. So for us in Dubai, we're part of DHA Dubai Health City Authority, and we need lab support. So we partnered with one of the labs that's in Dubai Healthcare City. If we need X-ray or imaging, again we've got partners. If we need to admit overnight and it's an adult patient, you know, we use City Hospital, which is a very good partner as well. And now for the children, all go to Al Jalila. So yes, we have to integrate being a specialist centre, and we're very lucky that we've got some great partners around us that we feel comfortable working with. I think this is a bit of a hot subject at the moment. I know GCC are actively pushing healthcare tourism. I think yes, there is an opportunity. Definitely, if you've got the good quality of doctors, you've got the specialist centres, then it will attract people. Can people afford to travel here for healthcare with the surrounding markets that we compete against? That's a separate question, but I definitely think there's an opportunity for healthcare tourism for sure. I mean, ours isn't really an affiliation, we are a branch. There's no affiliation about it. We are a full branch of Moorfields London. All our governance is governed by London, which is reported on a monthly basis. So that does make it tough because they have a very high standard in London, and they expect us to have to meet that. Also, we also have to meet the local standards with CPQ and GCC. In Abu Dhabi, obviously, they had a health authority. And I think that's something that putting all three of them provided together, I'm quite confident that we're in a good place in terms of reporting. The standards are very high, and we've learned stuff being here as well. So I think it does have added pressure for us locally, because we need to report back to London. We need to make sure that we're following our clinical standards, and they also need to understand that we're in a different market as well. So. And when you're perceived as a brand name, people have high expectations when they walk through the door. And that's from the way we answer the telephone to the way we process people. So the brand has definitely helped us in terms of attracting people, but it also means we have to deliver to that high level of care. No, it's like any licensing process in the country. You submit what you want your services to be, and it's no different within the agency. We submit the right services that we need to be, and that's what covers us under our licence. And I must admit, we've had a very, very good experience with our local authority here, and they're very helpful and they're constantly improving their processes. Personally, we're always looking to improve. We're looking to add to what we can offer in the region, and I think what we've done, I keep talking about Al Jalila, but what we've done with that, I think that shows our purpose of being here is to improve. Over the next few years, we'd like to do more in teaching. We'd like to get involved more in the research, which I think is coming with the new hospitals being built, and that will really be our big aim, is obviously to spread and start looking at research and teaching locally. The doctors and things.
All right. Fine. I think that should be good enough. Thank you.
All right, thank you very much.